So what types of men and women might benefit from support groups? I think anybody. Actually, my answer is there's not one type of person who is more suited to a support group than another. Support groups generally are quite tolerant of different styles, whether you're a man or a woman. So I think people who are looking for answers to how to do better with the long-term effects of their cancer diagnosis, breast or prostate cancer, who are looking for answers, who would like a safe and comfortable atmosphere where they can air some of their concerns, are likely to find it to be valuable for them.
In my experience attending the prostate cancer support groups, I find that a wide range of men do attend, and perhaps it's not what some men expect. There's a lot of information sharing, there's a lot of camaraderie built up in that process, and it's really just a good forum for men to come together around a common cause and give and receive information, and that all types of men can really attend, and that it might not be exactly what they have in mind when they think support group, or that it might not be for them.
What are the barriers coming to a support group? I think part of it may be in the name, the use of the word support. And perception is that when you use the word support, that you're going to reveal your inner feelings, or spill a bean, so to speak, with other people. And for those who are brave enough to come, they find that it has nothing to do with that at all. It's just a gathering of guys who have a common problem, and those who have said, well, I'm not going to say anything, after they're for less than a half an hour already telling everybody else what their problem is and quite prepared to share it.
The types of men I find that come to prostate cancer support groups, to me, my experience has been there's been a variety in that they've been newly diagnosed with prostate cancer and perhaps coming for their first time and have lots of questions, and ranging to men who have been coming fairly faithfully for many, many years. And there has been a few men that have maybe just checked in from time to time, maybe come once or twice a year, depending on what the topic has been, and that has been of interest to them, so that they've decided to attend that particular meeting.
The type of men that go to the prostate support group, there's all kind of people. Most of the people and the most interested are people that are newly diagnosed and that have to make a big decision, because when you have to decide on what you will do next, it's very difficult and can be very confusing. There's lots of information, but it's very difficult to make sense of all this. And quite often, you're a little bit in shock and you're looking for a quarterback, somebody that will make the decision for you, and there isn't. You have to make the decision ultimately, and then you have to process all that information, and it's very difficult. The prostate support group are really good to help you with that.
Well, every patient who comes to see me is seen automatically by a nurse at the end of the consultation and is given a package. Now, the patient is overloaded to an extent with information by the time they come. They come having been perhaps to the prostate center, and they come in with a book and handouts, but many don't. And so we give them information, contact information that includes the addresses and phone numbers of the local support groups, which are also advertised within the building. That's passive. For the patients that actively refer, it's those patients in whom I perceive there's a need. So patients who are struggling with making a decision, or who've asked me, are there other men that they can get in touch with who've had treatment A, so that they can ask their experiences.